Hi, this is Dr. Jerry Catapang with integratedpaintreatment.com in St. Louis, Missouri. Welcome. We are so excited because today we are launching our website, July 10, 2020. I'm so excited myself because it's actually my father's birthday today that we're launching this. And, we are dedicating this to him, and we're also dedicating this website to you, our patients, and anyone who has some, experience from their injuries, having a lot of pain, and would like to return to function or sports at the soonest possible time. This is actually the purpose of our website. Is for you to be able to, have the common answers to the common questions that you may have. And for today, we're going to be discussing a very, very important question. I think this is the most important question that you have for yourself, for your loved ones and friends and family who are experiencing pain. Today, we will answer the question, why are you in pain and why are you not getting any better? It's a very difficult and tough question to answer, but hopefully we have the best answer possible for you. And this is exactly what integrated pain treatment is all about. So since it's our launching day today, I would like to let you know that for the next week, months, years, we will be, posting a lot of video blogs, video interviews from medical specialists who can help you, have the answers, if not, provide you the treatments that you may need, for your pain problems. The next few weeks, months, we will be uploading, lots of information like to exercise when in pain is good, yes or no. To continue playing sports when in pain, is it bad, yes or no? Cortisone shot for pain is bad, yes or no? Pain pills and muscle relaxers are bad, yes or no? Inversion table, is it bad, yes or no? So we can have hundreds of questions that you may find them beneficial, for your recovery. So, the website is www.integratedpaintreatment.com. Please visit that, hoping, that this will, help you now. And, hopefully, you won't have those injuries, but, hopefully anyone who has the, the struggle in the recovery, that, people may find this website beneficial from here on. But for our launching, we will try to answer the question today, why are you in pain and why are you not getting any better? So, why are you in pain and why are you not getting any better? Here you go. When the specific cause of your pain is detected, then you will have the answer to your question, why am I in pain? When the specific cause of your pain is treated by the best medical provider to treat that specific cause, then you will have the answer to your question, why am I not getting any better? This sounds simple, but it's not. To detect the cause of your pain is not an easy task. For you to determine who is the best medical specialist to treat you for the cause of your pain is also not easy to know. To answer the question, why are you in pain and why are you not getting any better, is a tough question to answer because pain is a very complicated condition. We can now all agree that in order for you to get better, the cause of your pain is to be identified first. And this is not an easy task at all. It is almost impossible for your pain to get better or even for you to maximize your recovery without first identifying the cause of your pain. Pain is a complication of different conditions. Pain can be due to a physical dysfunction secondary to an injury. Okay, it can be from a medical disease. Emotional stress can also be a factor, or possibly even a combination of the three. It is also not uncommon for a medical condition, to manifest as a physical pain. We had this experience before with a couple of patients. They come with shoulder issues, but there was really no physical restrictions or any other physical problems, but they're having a right shoulder issue, but it's actually a gallbladder problem. Because a gallbladder problem can cause a referred pain to the right shoulder. So, you know, it's very interesting, and that's why detecting the cause of the pain, is quite a challenge for any medical provider, because of its complication. In our next blog, we will, in our next blog and our next video, we will help you understand how you can detect the cause of the pain. Is it medical, physical, emotional, or a combination? But for our purpose for today, we will try to help you, answer the question based on the physical cause of pain. So we'll just be dealing with the physical today, for the physical cause for today. So pain as a result of a physical injury has 4 issues, okay, that need to be addressed to relieve you of your pain. The first issue is, after an injury, you can have a structural damage, okay, an internal inflammatory issue, mobility restrictions, number 3. Mobility issue, it's a mobility restrictions in the joints, muscles, and soft tissues of the spine and extremity. And number 4, muscle weakness. I'll repeat it. There are 4 physical causes of your pain that need to be addressed for you to get better. Number 1, you may have a structural damage after an injury. Number 2, an internal inflammatory issue because of the injury. Mobility restrictions in the joints, muscles, and soft tissues of the spine and extremity, and muscle weakness. We all believe that early detection means early recovery. So for us to be able to achieve that, you have to remember that seeing a primary care physician, your family medicine specialist, is critical to the early detection of your pain. All the necessary initial medical tests that your primary care physician can do for you, you can definitely help. That they can do for you will definitely help in identifying the cause of your pain at the earliest possible time. Seeing your primary care physician is also critical, not just for detecting the cause of your pain, but also critical to your early recovery. See, during the onset and early phase of an injury, there will always be pain, there will always be inflammation, and there will always be muscle stiffness. So, treating these problems right away with medications will affect your early healing, early recovery, and your best recovery. Therefore, the initial tests and medical treatments provided by your primary care physician is of utmost importance. So, it would be to your utmost advantage to see your primary care physician first before seeing any other medical provider. Lastly, should it be necessary based on the initial medical test done, your PCP is the best provider. Your primary care physician is the best medical provider who can refer you to the next medical specialist who can help you more. See, most of the time patients are stuck. They don't know why they're hurting. Why you don't know why you're hurting. Who do you need to see? You get stuck. That's why it's very important, for you to see your primary care physician first. Again, pain is a very complicated condition. And there is really no one medical provider. There's no one guy or gal who can do the trick for you. It has to be a collaboration of medical specialists. If you have not seen your primary care physician yet, then this is one of the reasons why you are still in pain and why you are not getting any better. Now, a structural damage may or may not need surgery, depending on the severity of the damage. Your primary care physician is also the first medical provider who can detect this problem for you based on the initial medical test done. So, never ever skip your PCP. See your primary care physician first before seeing anyone else a few days after the onset of your pain and your injury. So, if you have not seen your primary care physician and you were not referred to a surgeon if necessary, then you are missing out. This is one of the reasons, the answer to your question, why you are still in pain and why you are not getting any better. Now, When surgery is not an indication, okay, you still have 3 issues left that need to be addressed so you can recover from your pain. These 3 issues that need to be addressed are, there's still possible internal inflammation, mobility issues or restrictions in the spine and extremities, and muscle weakness. As previously mentioned, a priority consult with your PCP during the very early stage of your pain can solve the internal inflammatory issue, especially during the initial stages of recovery. And this will really affect your long-term recovery as well. So, if you did not get any pain relief, okay, from the initial oral medication prescribed by your primary care physician, this only means that the internal inflammation that you have is more severe in nature. The oral medication may not be enough. Therefore, a more aggressive treatment for pain and internal inflammation from a physiatrist is necessary. This is so important, this is very important because a lot of our patients, patients, the public doesn't know much about what a physiatrist is. And this is one of the missing links. And this is one of the reasons why you're in pain and why you're not getting any better, because you don't have much knowledge about what a physiatrist is. So, if you have not seen your PCP yet, or you were not referred to a physiatrist or a physical medicine specialist, then you are definitely missing out. This is one of the reasons why you are still in pain and why you are not getting any better. A physiatrist? Yes, a physiatrist. It's so unfortunate when patients would tell me, Dr. Cadapac, I don't need a psychiatrist. I said, no, you don't need, a psychiatrist or a podiatrist. You need a physiatrist. So let's discuss, the next couple of minutes, let's discuss what a physiatrist, because this is so important. Yes, if your pain persists, okay, after taking oral medication, then you need to see a physiatrist. A physiatrist is a medical doctor, they're MDs, okay, who are trained for 3 more years after medical school to become a physical medicine and rehabilitation specialist, commonly called a physiatrist. Most of them even have a special specialization. Some of them even have a subspecialty in pain management and sports medicine. Again, unfortunately, a few patients know about physiatrists and the great benefit of the medical treatments they can provide. But not anymore. By listening to our podcast, you now know that, there's a specialist who can help you. And this is one of the reasons why you're not getting any better, right? So, why are they so important? For example, depending on the severity of your torn muscle, let's say, for example, you have a torn muscle, a physiatrist can repair the structural damage with an injection procedure using your own blood. This special technique is less invasive and less expensive. The healing time is shorter, so you will heal quicker. Okay, so that's one thing that a physiatrist can do for you if the damage of the severity of the damage is not that bad. Depending on the stage of the muscle tear, for example. If, for example, you have a rotator cuff tear, now that you know that there will be a less aggressive treatment than surgery, and you can determine that for yourself if you are referred to a physiatrist. Now, with regard to pain management, a physiatrist can provide you with pain injections, nerve stimulators, nerve blocks, etc. And some anesthesiologists also have a subspecialty in pain management. They can also provide these injection procedures for you. Now, when do you need this treatment? You need this treatment again when the oral medications did not work good for you, because the severity of the internal inflammation is severe in nature. And this has to be addressed. And if this is not addressed, then you're not going to get better. So if you don't know what a physiatrist is and what they can do for you, then you are missing out. You are actually missing out a lot. However, this is no longer the case, since you know now what a physiatrist is. And I hope you can share this information, to your friends and family, and you can refer them to our website, www.integratedpaintreatment.com, because, we can have all the information that you may need for you to be able to know the options that you may have when you're experiencing pain, so you can return to function into sports as soon as possible. Now, if you have not seen your PCP yet, or you were not referred to a physiatrist, then you are missing out. This is one of the reasons why you are still in pain and why you are not getting any better. Now, some patients had oral medications and injections for pain and inflammation, but they're still not getting any better. That's very frustrating. And patients are stuck again, right? You are stuck again. So, why are you still not getting any better after taking all oral medications for pain and inflammation prescribed by your PCP, and after having the cortisone shots and pain management treatments from your physiatrist? That's a big question. I've taken all the medicine. I've taken the shot. I had this number of shots, all the pills I've taken, but I'm not better yet. How many of you are experiencing that now? Now, remember, there are 4 physical causes of pain, and for you to get better and for you to recover, all of these 4 physical causes of your pain have to be addressed to help you achieve the best possible recovery from your pain. A structural damage, if you're referred to a surgeon, and the surgeon said surgery is not necessary, okay, is only one of the 4 causes of pain. When there is a structural damage from injury, but surgery is not an indication, then there are still 3 physical issues that need to be addressed. Internal inflammation, number 1. Number 2, mobility restrictions in the spine and extremities, and muscle weakness. Again, all these 3, plus the structural damage, all these 4 need to be addressed for you to get better. Now, when oral medications and shots were provided for the internal inflammation, but there are still mobility restrictions in the joints, muscles, and soft tissues of the spine and extremities, resulting in pain and muscle weakness, then the pills and the shots will just mask the pain. You got that, right? So even if you had all the medication for pain and inflammation, but there is mobility restriction in your spine and extremities, there will be compensation of the surrounding structures, then there will be pain, inflammation, and muscle weakness. Okay, so even if you have all those medication, the mobility issue and the muscle weakness need to be addressed. And that's one of the reasons why you're not getting any better. Mobility issue and muscle weakness are the other 2 possible physical causes of your pain. These 2 issues have to be taken care in order to maximize your recovery so you can return to sports and function at the earliest possible time. Now, you may ask me, how did the mobility issue and the muscle weakness issue develop into a problem after an injury? This is something that I'm excited to share with you, that I always, inform our patients the first time that they come, especially when surgery is not an indication, when they have taken all the pills and they've seen a physiatrist and they're still in pain. Because there's such a thing as a pain cycle. And how does this develop? Now, what happens is if you have an injury, you're going to have pain. And when you have pain, your muscles will guard to protect itself from the pain. The muscle guarding would lead to a lot of muscle tightness. When this happens, when your muscles become tight, okay, the soft tissue covering, the muscles have a covering called fascia or soft tissue, would also tighten up, making your muscles even tighter. As a result of the muscle and soft tissue tightness, the joint of the spine or the joints, the facet joints of your spine and your extremity joints would then become tight and restricted. So every time you move, the joint segments above and below your spine or the surrounding structures, around your extremity joint would have to pull and stretch just for you to do what you need to do. And this pulling and stretching, this physical compensation due to the movement restriction in the joint, muscle, and soft tissues would always result to pain, right? Because if there's a restriction, there will always be compensation, then there will always be pain. So when there is pain, the muscles will guard again. and the pain cycle continues. So, as long as these mobility issues are not identified and worked on, there would always be a physical compensation in your spine and extremity. Therefore, even if you had all the medication for pain and inflammation, there will always be pain. More so, if these mobility issues are not identified and worked on, it is quite impossible to recover from the muscle weakness. Not only that, you may even re-hurt yourself in the near future after recovering. This is why athletes, keep hurting themselves, because the mobility issues are not identified and worked on. And this is also one reason why they could not maximize their athletic performance, because there is a restriction in their spine and extremities. And this is quite important because, these two things, the mobility issues and muscle weakness, need to be addressed together with structural damage and internal inflammatory issue so you can have the best recovery. Okay? Now, as we mentioned earlier, the joint has to be in full range or close to it for the muscles to contract to its maximum and become stronger. The only time that your muscles will get strong is when your joint are in its full range, in your spine, in your extremity. The facet joints or the extremity joints, they have to be in its full range or close to it so your muscles can become strong, right? Otherwise, instead of contracting to become strong, the muscles will pull and stretch, resulting to what? More pain, more inflammation, and more weakness. And for you to get better, those weak muscles which have been pulling and stretching, right? They have to be what? Strong again. That's why we are addressing muscle weakness as one of the problems, after you have an injury. So a doctor of physical therapy, your physical therapist, is responsible for detecting and treating these abnormal movements in the spine and extremities. Restoring normal mobility would restore muscle strength and function. Restoring normal mobility would also eliminate any compensation and would help decrease, if not eliminate, your pain in conjunction with the other treatments that you had. The oral medication, okay, and the shots if it was already provided. So if the mobility issues are not identified and worked on, the medication and the shot you have previously received can just be masking the pain. Now you understand that, right? If you already had the shots and you had the medications and you're still hurting, it's because of the fact that the mobility issues in your spine and extremities were not addressed yet. So if you have not seen your primary care physician and you were not referred to a physical therapist, then you are missing out again. This is one of the reasons why you are still in pain and why you are not getting any better. Now, you're going to say, oh, Dr. Katapak, I've seen a physical therapist. I've actually seen a physical therapist for a long time, but I'm not getting any better. Now, if you have seen a physical therapist, if you've seen your doctor of physical therapy, and your physical therapist has identified the mobility issues and the restrictions are taken care of, but there is a lot of internal inflammation, then it is also not quite possible to maximize your physical recovery. This is one of the reasons why you are in pain and why you are not getting any better. Okay? Because you have, the issue of the inflammation, and also you have the issue of the mobility restrictions and muscle weakness. So for the best possible recovery from your pain, both the mobility issue and the internal inflammation issue must be treated at the same time. Therefore, a close working relationship among your primary care physician, your physiatrist, and your doctor of physical therapy, your physical therapist, is the key in taking care of this problem, should surgery is not necessary. So in conclusion, a collaboration between your primary care physician, your family medicine specialist, a doctor of physical therapy, your physical therapist, a physiatrist, your physical medicine and rehabilitation specialist, and a surgeon, your orthopedic surgeon or neurosurgeon, is deemed necessary for the early detection of the cause of your pain and for your maximum recovery from the pain. The result of the close working relationship of these four medical specialists would allow you to return to sports and functional activities at the earliest possible time, especially after the detection of the possible causes of your physical pain has been identified. So the collaboration of these four medical specialists is now called integrated pain treatment, called IPT. So this is what our website is all about. This is what integratedpaintreatment.com is all about. And with that, we're going to be, sharing with you lots and lots of information and video interviews from medical specialists, who would be able to help you understand your pain and help you recover from it as soon as possible. So the answer to why you are in pain, it is simple. The cause of your pain was not detected early, or the cause of your pain has not been detected yet. And that's the reason why you are in pain, or why you are still in pain. The answer to why you are not getting any better is simple as well. It is because you have not seen the medical specialist who can help you treat the cause of your pain after it was detected. You don't have to be hopeless. A lot of patients are sometimes hopeless, and I feel so sad for them, especially when athletes would say, this might be the end of my career. I may not have the scholarship that I'm shooting for college. Don't be, because there is always an appropriate treatment for each specific cause, as you have understood so far, in our discussion today. Remember, there is always an appropriate treatment for each specific cause of your pain. It is just a matter of detecting the specific cause and having the best medical specialist treat that specific cause after the cause of the pain was detected. So the answer to your question, why am I in pain and why am I not getting any better, can be answered with integrated pain treatment. And yes, there's a lot of other, medical providers, great medical providers. We work with a lot of other specialists, acupuncturists, chiropractors, massage therapists. They're all good. They're great adjuncts, to integrated pain treatment. But for our experience for the last, 30 plus years, we find integrated pain treatment collaboration of these four medical specialists, the best so far, in our experience. And I think, with the knowledge that you gained today, that everything makes a lot of sense. It's very simple. We try to simplify it the best we can, that the masses could understand what we talked about. So I hope you learned from it today. I hope it answered some of your questions. Visit our website. If you think this is beneficial, please share it with your friends and family. Please like, subscribe, and share. And visit the website, www.integratedpaintreatment.com. This website is dedicated for you, our patients, and to your loved ones. So hopefully, this information and the information that you're going to get from our website, you will find beneficial, because we would like to help you detect the cause of your pain at the earliest possible time, so you can return to sports and function at the earliest possible time. Again, this is Dr. Jerry Catapang with integratedpaintreatment.com from Springfield, Missouri. Have a wonderful day. Bye now.